Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
cardiovascular findings in thyrotoxicosis. If you were asked what is the most common cardiovascular manifestation seen in thyrotoxicosis is most common cardiovascular manifestation in thyrotoxicosis is sinus tachycardia. In this sinus tachycardia, the patient is this sinus tachycardia is actually associated with, because it is a tachycardia, obviously the patient will have palpitations because of increased heart rate, and it is also associated sometimes with supraventricular tachycardia is also seen in some patients. Okay, then the other manifestations are the patient might present with exertional dyspnea may be seen. Then there can be hyperactive procardium is seen with loud first heart sound. There will be the procardium will be hyperactive. You will see presence of loud first heart sound is seen, and also there is increased second heart sound is seen. Especially there will be the P2 component. There is loud P2 component of second heart sound is also seen in these patients. These patients with thyrotoxicosis will also present with asystolic ejection click is common. In patients with thyrotoxicosis, one important thing is this thyrotoxicosis is a high cardiac output state. Because thyrotoxicosis is a high cardiac output state, the patient will have a bounding pulse. Okay, the patient will have a bounding pulse. There will be wide pulse pressure is seen, and also an aortic systolic murmur is also seen in the patient. And as a result, because of high bounding pulse, widened pulse pressure, and aortic systolic murmur, this can result in worsening of angina, or the heart failure might worsen in the elderly patient. Then, if there is thyrotoxicosis in the patient, this thyrotoxicosis can also lead to atrial fibrillation, and this atrial fibrillation is more commonly seen in patients who are, especially it is seen in elderly patients who are more than 50 years of age. In them, atrial fibrillation is common. And there is one important thing is we have means Lerman scratch is associated with thyrotoxicosis. In means Lerman scratch, it is actually a systolic scratch sound. It is a sound which is heard. It is heard in the systole, and it is mainly heard in the second intercostal space. It is heard in the second left intercostal space during expiration, and this is called as means Lerman's scratch. And the patient also presents with systolic hypertension also. So these are the main manifestations due to thyrotoxicosis.
thank you and thank you for watching.